Dr. Dan Yachter here for News Views Weekly Updates. This is being broadcasted in our private Facebook group, My Family, My Mission. Thank you so much for joining me. And each week what I do is I try to bring you the most pertinent, relevant, important, interesting articles, headlines that are on the healthcare landscape. And I pray that these are helpful for you. And we're going to go ahead and jump into the different postings. As I go through them, you'll see them in the Facebook group here. I put them in there for those who want to dive a little deeper into the content and learn a little bit more. So let's go ahead and take a look at what we have here. First article I'm going to bring up is going to be the one that talks about exposure to common chemicals in plastics tied to heart disease and deaths. Talk about the phthalates, the different things that are in the different environmental products that we're using, environmental toxins in the products that we're using. Hey, Cece, welcome. And so one of the things that I really try to do as often as possible is not drink out of plastic. This is a glass bottle that I have. It's got a neoprene cover on it just for traction, so I don't drop it. The glass doesn't slip out, but and it's a lot safer to have something covering it. But this is glass, and I fill it up with water from our reverse osmosis container in the back of the office here. So this article, and I'm going to go ahead and bring up on my side of things here. I'm going to bring up the article. So I'm going to give you the highlights again. If you want to dive a little deeper into the details and content of the article, it's there for you. It's posted in My Family, My Mission. For those of you guys who are watching on our different platforms, including YouTube, you may not have access to the articles, but if you want access to the articles, you can ask to join our private Facebook group, My Family, My Mission, and you'll see the articles posted there so you can read more about them. But what the article talks about is daily exposure to a type of phthalate, chemicals commonly used in polyvinyl chloride products like piping, medical tubes, end bags, and cling films, kind of the plastic wrap that you put over foods or bowls that you want to keep food fresh. The article talking about how it may be linked to more than 13% of deaths from heart disease globally in 2018, according to a new study. The research specifically implicates di-2-ethylhexyl phthalate, a type of forever chemical used to make plastics more flexible, as a significant public health threat, and it was attributed to 350,000 heart disease deaths among people 55 to 64 worldwide. So again, there's quite a bit to this article, but just a very important reminder, when possible, opt for glass, stainless steel, or phthalate-free alternatives for food storage and children's toys. Reduce consumption of processed and packaged foods in favor of fresh whole foods, because a lot of the packaged foods are packaged with these plastics or exposed to the plastics. Clean areas where phthalates can accumulate frequently and minimize household dust. So again, the most important or best lateral move you can make is just simply make sure you're, as often as possible, not drinking out of plastic bottles. Try to get glass when you can. So that's a good article to dive into if you want more information on that. But again, we don't want more, we want less toxic exposure. And that's just one great way to do it. Just drink out of glass. And again, it is safe if you have it wrapped in something that's soft, just in case you drop it. Another article, let's go ahead and move on to the next one here. When you fight the night, 5 exercises to help you conquer occasional insomnia. We talked about this last month. This was a really important one. And there was an article, a scientific study that showed that sleeping medications that so many millions of Americans take actually blocks the enzymes involved with the glymphatic system, the movement of fluids, specifically at night, through our brain-blood barrier that helps carry toxicity out of the brain and nutrients, fresh nutrition and hydration into the brain. So there's this flow, this ebb and flow of toxicity out, nutrition in. And this groundbreaking study showed how the pharmaceutical agents in sleep medications and sleep aids actually block the enzymes involved with brainwashing, with washing the brain while you're sleeping, which keeps the brain healthy. And if you're blocking that process, then the brain is going to age very quickly, and it could lead to or heighten the risk of brain diseases, early cognitive impairment, including Alzheimer's and others. So this article is a good one. And there are exercises in there that are shown to help with insomnia. But the one that really stands out to me or stood out to me that I really wanted to talk about, and I really picked up on this through my Oura Ring. The Oura Ring it's a biometric ring. It's like a smartwatch or a Fitbit or an Apple Watch that picks up on data, especially when you're sleeping. It collects a lot of data, like the amount of deep sleep you're getting, the amount of light sleep you're getting, REM sleep, your breathing patterns at night, your heart rate, a lot of very important biometrics. But what I have found in terms of my sleep and my sleep quality significantly going up when I exercise, or really the more steps I take during the day, especially if it's closer to bedtime. So like if it's an after dinner walk and I go, let's say it's a mile walk or a 2 mile walk, my sleep quality significantly improves. And so there are a lot of different useful tips in this article when you fight the night, 5 exercises to help you conquer occasional insomnia. But the first one I like the most, walking, because I find that I could actually quantify that. I can measure that on my Oura Ring. And if I go for a 30-minute walk, I get an extra 2,000, 3,000, 4,000 steps a couple hours before I go to bed. My sleep quality, I could get to bed quicker, and I stay asleep longer. I don't have sleep disturbances, and my quality of sleep overall, registered by my biometric Oura Ring, much, much better. So that's a really good article there. If you want to dive a little deeper, again, the whole article is it's posted here in the group. RFK Jr., Robert F. Kennedy Jr., announces a ban on artificial dyes in foods and drinks. I put the article in there. This was already a few weeks back, but again, I'm not going to read you the whole article. I'll read you the top of the fold here. The U.S. will ban 8 commonly used artificial food dyes in a bid to help Americans know what's in their food. Health Secretary Robert F. Kennedy Jr. announced on Tuesday, and this officially came out April 22nd. Officials said 2 petroleum-based synthetic dyes would be phased out in the coming weeks, and others by the end of 2026. Experts have linked the dyes, which are found in dozens of foods, including cereals, candy, snacks, and beverages, to neurological problems in some children. The Food and Drug Administration, the FDA, plans to authorize 4 new natural color additives in the coming weeks to help companies find alternatives quickly. Americans don't know what they're eating, Kennedy said at a news conference. So the remaining dyes, I'll read you a little bit more here. On Tuesday, the health secretary pledged to tackle other food additives, including every ingredient additive to food in school that we can legally address. Synthetic food dyes are found in dozens of popular food products, including M&Ms, Gatorade, Kool-Aid, and Skittles. Don't drink the Kool-Aid. For the last 50 years, American children have been increasingly living in a toxic soup of synthetic chemicals, FDA Commissioner Marty Makary said. Makary said removing the food dyes is not a silver bullet, but one important step toward improving children's health. 6 remaining synthetic dyes, FD&C green number 3, red number 40, yellow number 5, yellow number 6, balloon number 1, balloon number 2 will be removed from the food supply by the end of next year. All right, so this is good. Moving in the right direction for certain. More information. There's a great article on the Mediterranean diet, reducing pain, chronic pain. A little bit on that article. I wanted to cover just a quick bit. I mean, there's quite a bit on this in this article to pick up on, but what they're talking about, and then what I wanted to cover, the main things in the Mediterranean diet that really help drive down inflammation, drive down pain, are things like alpha-lipoic acid. Alpha-lipoic acid are in wild greens, plentiful in the Mediterranean cuisine. Alpha-lipoic acid converts blood sugar into energy. And alpha-lipoic supplements have been shown to decrease inflammation. Spinach, kale, arugula, and romaine lettuce, broccoli, peppers, Brussels sprouts, tomatoes, potatoes, peas, all contain sources of ALA. Another component found in plentiful amounts in the Mediterranean diet, CoQ10. CoQ10 is shown to significantly lower inflammation and pain levels. Dietary sources: oily fish, sardines, mackerel, anchovies, salmon, herring, lean chicken, walnuts, sesame seeds, and germinated whole grains have a lot of CoQ10, including barley, buckwheat, bulgur, farro, oats, polenta, and rice. So again, CoQ10 is the diesel fuel for the mitochondria to drive ATP production or energy production in the body. Another one that's really important, hydroxytyrosols. Hydroxytyrosols are found in olives, olive oils, olive fruit, the pulp of the olive, extra virgin olive oil, Evo, extra virgin olive oil, and that drives down inflammation. It helps immune cells make interleukin 10, which calms inflammation. The Mediterranean diet is rich in omega-3 fats found in fish. There are plant-based sources, but omega-3s, DHA, EPA helps drive down inflammation. And of course, limiting your processed foods, replacing packaged snacks, chips with hummus and pita bread or vegetable fruits, nuts, and yogurt, far healthier. So nonetheless, great article, and it just gives us a glimpse into why the Mediterranean is so powerful, the Mediterranean diet is so powerful in reducing inflammation. Next article is a great one. Shocking 22-year study finds exactly what I've been talking about for over 25 years at my master classes. Cece, who's watching right now, and many others who are watching, who will be watching later on, you've heard me talk about this for over 2 decades, going on 3 decades at my master classes, talking about that you cannot allow your doctor to put you on a statin based on just total cholesterol or LDL. You must factor in the ratios, total cholesterol over HDL, but more importantly, triglyceride HDL ratio and your LDL HDL ratio. So this article talks about very, very important research. I'll give you the opening part of the article here, and then I strongly recommend that you especially dissect this one. Go through this article. This is from, let's see where it's published in the journal, I believe, where it is. The article, I'll tell you where it comes from in just a moment, but it just simply talks about how for years mainstream medical advice has emphasized lowering your LDL to reduce the risk of cardiovascular disease. However, a recent 22-year follow-up study challenges that notion. When your doctor freaks you out about your LDL level, you should challenge that notion. They're saying here, suggesting that low LDL cholesterol might actually increase your risk of death from cardiovascular related disease. Well, this is really, or cardiovascular related causes, this is really flipping things on its head. This study titled, "Is LDL cholesterol associated with long-term mortality among primary prevention adults?" It was published in 2024 and analyzed data from 177,000 individuals within a large healthcare system outside of Pennsylvania. The study's most surprising result was that lower LDL cholesterol levels were linked to higher death rates over the follow-up period. This contradicts the common belief that lower LDL cholesterol is always better for heart health. Survival rates and LDL cholesterol levels. The analysis revealed that individuals with LDL cholesterol levels between 160 and 190, or 160 milligrams per deciliter to 190 milligrams per deciliter, had the highest survival rates. That's twice the level of what your doctor wants your LDL level to be at. On the contrary, those with the LDL levels at 30 to 79 milligrams per deciliter, which is where your doctor's trying to get you, had the highest death rate or the lowest survival probability over the study period. Mainstream guidelines often recommend maintaining LDL levels below 100, and some studies even advocated for levels as low as 30. However, this new data suggests that extremely low LDL levels can be detrimental rather than protective. So the study introduced a U-shaped risk curve. Mid-range LDL, 100 or 159, are associated with the lowest risk of cardiovascular events. Triglyceride HDL ratio was shown to be the real risk factor, which is what I've taught my patients for almost 30 years. That the most important thing that you want to look at on your blood panel is your triglyceride divided by your HDL, or the triglyceride HDL ratio. High total cholesterol to HDL ratio and high triglyceride to HDL ratio were linked to a greater mortality risk. So again, I strongly recommend that you look at this article, you read through it. Very, very important. This study challenges the long-standing narrative that that lower LDL cholesterol is always better, while more research is needed. These findings suggest that maintaining moderate LDL levels, 100 up to 200, managing triglycerides is the more important number always. That really is the most important number on your blood lipid panel. And improving HDL cholesterol might be a more balanced approach to preventing cardiovascular disease. So as we learn more, it becomes clear that cardiovascular health is far more complex than just your total cholesterol or a single LDL cholesterol number. A more nuanced approach considering total cholesterol, triglycerides, HDL cholesterol, and other risk factors might ultimately lead to better outcomes and longer lives. It's a great article for certain. So when you have a chance, I strongly recommend that you look through that one, really important one. And then the last one that we have published here, let's see, I published one more. He's got one more to cover. And that is pulling back the curtain. The National Institutes of Health will use Medicaid and Medicare records to study autism. It's a very important initiative has been launched by the National Institutes of Health, looking to uncover the root cause of autism. And the CDC, NIH, the Centers for Medicare and Medicaid, CMS, Health and Human Services that houses all of those organizations, they're all coming together to look at why has there been such an explosion in the rate and cases of autism over the last 30 or 40 years. 40 years ago it was 1 in 10,000. Now it's 1 in 30. Some states it's 1 in 12. There's a big problem. And a lot of it is being linked, or at least right now, currently, there's a suspicion that it could be vaccinations that are creating the problem, that have created the problem over the decades. but hopefully we'll get answers. We'll have a firm, definitive response in the way of lots of research data. It's going to take a while to cull all the information through the Medicaid and Medicare system and to really understand. I mean, there's just millions and millions and millions of reports of autism, and it's going to take a while to really go through it for them to finally come out and say, here's what's causing autism, or here are the 2, 3, 4, or 5 things that are causing autism. But this is a great initiative, and I'm certainly looking forward over the next coming months and years of really getting answers, especially for parents. And if vaccines are implicated, parents need to know that truly vaccines are potentially the number one reason your child can become autistic or develop autistic tendencies. So this is a really, really important initiative. And if I didn't mention it earlier, we have coming up on Tuesday, May 20th, 6:30 p.m., slowing your aging process down, slowing the clock. Who out there wants to anti-age? Well, there's no such thing really as anti-aging. You can't stop, you can't reverse aging, but certainly you can slow it down. There's no doubt about it. And I'm going to be covering the main factors involved in achieving that. We're going to lay it out for you. I want you there. If you're an active patient, get to this masterclass. Yours truly will be teaching it right here in our office, Elevation Health, Lake Mary, 6:30 p.m. For those of you guys who've been there before to the master classes, you know I start 6:30 p.m. sharp. It's going to be a phenomenal learning and growth experience, slowing your aging process down. Please join us. It's going to be a great one. Bring friends, family members, and loved ones, and we're going to learn and grow together. And as I always tell patients, your spine is crucial. Getting structure, neurological, and functional health restored, crucial. But what's more important than the spine is the mind. We need to fix and nurture and empower your mind, and then what follows is the spine. We must give you and I together. Once we're learning and growing, we want to bring others from the community to get this knowledge, because my mission in life is to build this community up, empower, equip, and elevate the quality of health and the quality of life so the families of our community can really live the life that they desire. They can have the quality of life to express their God-given potential. They can live their best life. That's what we want for the community. That's why we do these master classes every month. That's why this office exists, to help this community be the best they can be, to help this community raise the healthiest families they can raise. So please join us. And as always, thank you for joining me every Wednesday on this segment for My Family, My Mission. Dr. Dan Yachter signing off. God bless.